Okay. Okay. Good. Good morning, everybody. My name is Kornkit Chaijenkij. I came from College of Sports Science and Technology. Thank you, RCOST, for giving me opportunity. I think this topic is for me. I want to encourage you to improve your surgical outcomes. You know, right now we work with athletes, right? When they injure and they come to see us. This is my example case. This case is the high-performance athlete who have ACL injury, isolated, good meniscus, and good cartilage. We do ACL reconstruction for 1 year, but after that, he returned to play. He's a world-class player for Thai team. So the main problem is that because I look at the team and he came to see me every week by the knee pain. But you know, for our examination, it doesn't reveal any abnormality. The Lashman is good, McMurray is good, but he said that the performance he went down all the times. And in one day, I decided to do arthrosynthesis, and I found they have some effusion, but it's not much. So the key principle is that, I mean, if we look at the structure, everything is good, but the athlete, they complain the symptoms, and they cannot train well. So I think this one, if we talk this topic today, the road, if you know very well with this, we will improve the outcome of surgery. Right now, I mean, the sport in the world right now is not just the sport. This is the professional, this is the passion. So I think we have to focus on performance and athlete more than the structurals. So right now, the athlete in everywhere, they have to do the drill with the training. So, I mean, you know, Ajahn Mason already mentioned to the pain. If the training, they will have a pain, but a pain is good to control the training deal and make the optimum recovery. From this slide, we show that it's classical. You can see on the upper slide, every time when they give the training, the body will injure. But I said that it's good injure because when they recover, the performance and the body will better. But in contrast, if you make a bad training or an optimum load, every time when they're training, they will not good recovery, and then the performance will going down. In this principle, when I read this one and I know that in my athlete, I think he got something abnormal for the training, maybe too much or something like that. That's why, I mean, when they're training, he's going down for the whole time. And if you follow the news, you will know some athlete that he used to be good, but right now he's going down because I think he have a problem of an optimum road. And the same way, we know that if we exercise, right, we will lower the list of the illness. And also for the athlete, when eventually, I mean, if they train high, they have the paper that said that they still have a better chance to be more strength than the normal people. In this video, I just show you that on the left-hand side, this is my student who play the same sport. On the right side, you can show the movement, right? I want to ask you the question, into player, is it different? Someone said that the same, the jumping from the box. But if you look more deeply, you will see a good one and a bad one. So for me, I can predict that on the left side, eventually he trained a lot. Finally, he got injured with the knee. But on the right side, I think it's more opportunity to make better, to prevent injury. In this picture, I want to show you that the load is not just for the frequency or the duration, but you have to look at the biomechanics and the movement also. So in this picture, it shows the bad load of the joint. Great. Okay, and another factor that we have to concern when we go with the athletes, because right now, I mean, the sport is like worldwide. They have to travel a lot, and you know, when they travel, when they change the time zone, they will stress their body also. And of course, because of right now, the competition is quite crowded. I mean, if you don't talk to the federation or don't speak with the coach, with the optimum training, they will injure easier also. And the same thing with the pain, the psychological effect. Right now, they have the effect of the load. I think in right now, the psychological effect for us, for the injury, they have three aspects. The first one is the mental fatigue when they train a lot. The second one is that the anxiety. And the third one is that fear of re-injury. I recommend that if you want to improve your surgical outcome, you have to think about three things. And right now, the world for the reconditioning and return to play, they focus on this also. I think if you did very well, your surgical outcome will be better. So for us, I mean, after you do surgery, I think you need to do the monitor load also. Because of right now, if you keep a bad load for the injured patient who did you do surgery, finally your outcome will not good. I think this is the key. And the coach is the key also. Because when we work with the athlete, we are the support team, right? But the coach is the main key. If you don't work with them well, I mean, your procedure, your surgery will fail finally. And the load, because right now the athlete, they train really differently. I recommend you to do individually for every athlete. And for the evidence base that IOC consensus, they said that right now they have the best load monitoring right now. But if you look more for the sport, I mean, especially for the soccer, that they did a lot of study, they will have some tools to help you to monitor load. Example, in this picture, you can download from the internet. It's the exposure time for the training. Example, how long they're training, how often. I think if you know some, and you can have some data to talk with the coach and the team. So for me, right now I interest for the monitoring of the injury also. Because if we monitoring the injury with the team, you will have your own data and you have your own information to prevent the injury and to make them be better. So I recommend you to do the injury surveillance with your athlete or your team that you involve, because you will have your own data. And right now they have a lot of tables to record the injury, but for me, I recommend you to do your own, because you will know what you want to know and what you want to do. So right now, the injury monitoring, the load, they are focused on active. The active is mean you need to focus on every athlete with every week by some tools. In right now, they have some paper. They recommend you to do the questionnaire tools to look at your athlete, and if they have something abnormal, you can go to see them and what is the problem, and you can correct them before they injure. So yeah, something like this. This is the question that they ask the athlete every week about the pain of the joint or the performance of them, and something like that. If they have something abnormal, they will trigger you to go to see the athlete. For me, I will tell you that this is kind of active treatment of the injury, because if they have the problem and if you attack them fast, you can see what is the problem and you can treat them or you can prevent them from injury. And I think from my experience, I think this questionnaire is quite good, because I do with my team and I can detect a lot of injury before they have a major injury. And this is my research right now that I try to validation this questionnaire. And if you're interested, you can download them. I will probably in next year, because I want to make a tools to make our doctor to be easier to detect the injury. And finally, I help to make you easier. I try to do an application with faculty of ICT in Mahidol. And then I will distribute to the team doctor and to the orthopedic surgeon who take care of the team. And finally, we have our own tools and our own data in Thailand. So summary, I think the data of the injury is the data from the load is correctly to the injury. And the athlete is quite different in every athlete. You need to focus on sport and individually. And the load monitoring, the injury monitoring, is the one who you have to focus on that. And finally, I hope that, if we do well on Thailand injury station, it will make your post-operative better. And of course, I want you to think about athletes. They don't focus on structural. When they come to see you, they want to return to play and good performance. So the load monitoring is the key of that. And finally, because when we are doctor, we work in the hospital, but when you are with the team, you work with the coach and the sports side team. So you have to communication with them and work with the team. If you have any information or you need some tools that I use, I can send to you by my emails. So please keep in touch with me. Thank you. Okay.